So we just want to welcome folks as you're joining on. We're so excited to see our community ambassadors joining us. We have some great updates for you, and I'm so excited to be here with Dr. Cody. So we're going to let folks join on, and we are asking for this emergency meeting because we're going to ask for your emergency help in making sure we get out the information that we need to get out. So we're just going to give folks a minute to join us and want to say welcome to all of you. This is going to be a 30-minute meeting. I know you CAP ambassadors are used to the trainings that we've been doing. And so you're used to getting a lot of information. And so as I see we've got folks, I just want to say again, welcome, welcome. We're so excited to see you. And we just want to say thank you to all of our CAP ambassadors for all the work you've done, getting the word out, volunteering, helping us get people vaccinated. And because of your efforts, 75%, let me say that, 75% of residents 16 and older have received at least one vaccine dose. So we are really, really grateful to you. Now, we're excited about where we are, but we cannot take our foot off the gas. We are so, so close. And so the purpose of today's call is to provide a very brief update on our local vaccination efforts and ask your help because we want to really ramp up communication. As you know, our county has held a goal of vaccinating 85% of all of our residents by August 1st. And we feel like we're going to get there, and we're moving that date up now to June 15th. And that's a date the state's expected to open. So we want to make sure our folks are safe when that happens. And as I said, we're currently at 75%. To get to 85%, we need 267,000 more residents, now including our 12 to 15-year-olds, to get that first dose. So to do this in less than a month, we need you. We need our CAP ambassadors, and Dr. Cody, who's been leading our way, knows how much we've been relying on our volunteers and all of you. So we need to make sure that every single family member, neighbors, friends, classmates, and coworkers go and get vaccinated. And when we reach out to them, we don't want to just ask them to do it for themselves. We mean to ask everybody in their family, right? We're not just talking to one person, we're talking to everybody. Now, we have done a lot to open up our vaccines and make it easy for people to get them. And I know you, like us, are just anxious to help people get back to school and to work and to be able to do all that safely. So as many of you know, we've recently, to kind of spice things up, we're trying new things. And one of them was that we recently hosted teen vaccination nights at Levi Stadium in partnership with the 49ers. And because of the success, and we gave tours and NFL things, football-y things to people. And as we promote future vaccination events and incentives, we really need your help in spreading the word, and we're going to have some fun incentives. So what I'd love to do is let Dr. Cody, and I'm so grateful, Dr. Cody, that you're here, and I'm really grateful to all the amazing work that you've done on behalf of the residents, frankly, not just of our county, but across the state of California. So let me turn it over to Dr. Cody, who really has not rested. And I am really so honored to be able to call her a colleague and a friend. And she's going to give us a brief update on where we are with our local vaccination efforts.
Thank you so much. It's a pleasure to virtually see everybody. And thank you for all of your work on behalf of everyone who lives and works in our county. I am in a very optimistic mood today, I have to tell you. I am thrilled with the progress that we're making on vaccination. And I am thrilled with the impact that vaccination is having on the health of our county. We're seeing our case rates go down, number of people in the hospital go down. And I sometimes in the last couple months, I've been talking about team vaccine and team variant, and I think team vaccine is winning. I really do. So I think we're in the, we're in the last leg of this ultra marathon. We have to, keep all of our energy and all of our focus. We want to finish strong, and we want to finish fast and get this behind us. As Supervisor Chavez mentioned, we now have 75% of everyone 16 and up having, that's the formally eligible population having gotten at least one dose. Now, as you all know, 12 to 15-year-olds can also get the Pfizer vaccine, which is fantastic. And if you look at the dashboard we have, you'll begin to, we can all track that together, how we're doing. I think that sort of the top level message that I really want you all to know, I think it's kind of obvious, but we've got gobs of vaccine. So supply is no longer a problem as it used to be. We've got lots and lots and lots. We have lots of different venues where people can go get vaccinated, from mass, high throughput sites like Levi's and like the fairgrounds, to little tiny mobile sites at schools and other places in the community. Lots of community partnerships. But what we still need is to get eligible people who haven't been vaccinated to those sites, and to help anybody who's feeling a little unsure, or like the barrier's just a little bit too high for whatever reason, to assist them to taking the step and getting a shot. And we've been doing extraordinarily well, and I don't know why we can't continue to do that until we finish up. Is there anything else, Supervisor, that you hope I would address or share with this team that you have assembled?
Yeah, just a couple questions, just to make sure that that we answer some kind of core questions of folks. And one is, when will we see statements from our various city mayors and councils that will help us validate the information? And on that front, what I'll say is that all of your mayors have been part of our community meetings, and that's a good point, that we'll work with them to make sure they're pushing out this information to be very consistent. And then Dr. Cody, can you just talk about the double mutant coronavirus that's caused so much havoc in India, and does Pfizer and Moderna protect us from this new virus?
So the information we have so far, actually, think that also reminds me something else that I want to say about the vaccine. So we're learning, this whole pandemic has been about learning, and then changing our guidance and changing what we do based on what we learn. And so the new learnings that we have about the vaccine are two. One is the vaccines that we have authorized for use in the US are performing very well against the variants. I don't have specific information about the variant that's emerged in India, but in general, the variants are emerging and the case rates are going down. And for the studies that have been done looking at particular variants, vaccines have done really well. We, as you know, are a huge county with a fantastically diverse population, and people are traveling in and of our county from, all corners of the world for personal and professional reasons. And certainly a lot of people living in our county have friends and family in India. So we have had a number of people arriving back from India. We have identified the variant that's circulating in India, but it is not taken off. And so that's really, really important to know. It has not taken off. The vaccines are doing great. The other kind of newish information is we're now very confident that if you're vaccinated, that protects you from getting an infection with no symptoms and spreading it to somebody else. That's really, really important, because before we thought, the vaccines are fantastic at keeping us from getting really sick. They prevent us from having to go to the hospital, and they prevent death, but we're not quite as sure whether they would prevent us from being able to get infected, not have symptoms, and spread it to a family member who was not yet vaccinated. Now we understand that the vaccines prevent us from spreading the infection too. So that is huge, 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 huge. Sorry, I forgot to make that point before.
Thank you for that. And then one question is, when would unvaccinated employees be able to remove their masks at work? So
this has been the big discussion, right? So the CDC shared the science, and I just kind of reviewed that the vaccines are very effective, very safe, and keep us from spreading it. what was a little bit missing was, so how do we implement that, right? We're in a public space and there's all kinds of different people. Some are vaccinated, some are partially vaccinated, some choose not to be vaccinated, some can't get vaccinated, et cetera, et cetera. So what do we do? So the state came out today and made clear that in California, what we're going to do is we're just going to keep the masking guidance that we currently have at least through June 15th, because it's more protective and we want to make sure that we're getting the levels of vaccination really high. That being said, if you are in in a private setting with other family members and you all know each other's vaccination status, you can be inside without your face covering among a group that's fully vaccinated. And you really don't have to worry that you're going to spread it around. So that's really a huge relief, because I'll be honest, I've been vaccinated. I was still wearing a mask indoors in many settings, even when I knew that everybody was vaccinated, because like my mom, I was like, well, I really wouldn't want to chance it. Now I feel quite confident taking my face covering off when I'm with my mom, who is also vaccinated.
So we got one question about, what about getting Santa Clara County soccer and hockey teams sponsoring events, and who are really focused on getting the parts of the community that are less likely to be vaccinated. And the good news is the Earthquakes, the Sharks, the San Jose Giants, and the 49ers have all been incredible partners and have been helping us with tchotchkes and masks. And we will be doing an event with the Earthquakes, as we are doing not quite this at the same degree we're doing with the 49ers, but with the Earthquakes. And the Sharks have been great, letting us have Sharky and team players and, all kinds of treats for people to get, which we'll talk about in just a minute. And then, let me just look, are employers still directed to maximize telework for workers who can do their jobs remotely? And will this change on June 15th?
So the maximized telework is a local county order, and that is from way back in October. And I can tell you that will go away before June 15th, so you can look forward to that. The other thing I would say is we are doing so well with our declining case rates, and they're consistently marching down, that I'll pay anyone, I'll pay you $1 million if we're not in the yellow tier officially on Wednesday. We're going to be in the yellow tier. That's where we're heading. So that's good too.
$1 million. So you all heard
$1 million.
Yeah. Because you're cap
and I don't have $1 million, so I can make that promise.
So one question is, what is the best vaccine choice for children 12 and up?
So there's only one vaccine that's authorized for ages 12 to 17, and that's Pfizer. So if your age is 12 to 17, your only option is Pfizer. That's one of the two-dose vaccines.
So Dr. Cody, this question has come up from a number of different folks in different ways. And one is, not take people's, for people not to take their masks off too soon, and India being an example of, just what can happen when you slip back. But one question that people are asking is, what happens in workplaces where you have vaccinated people and unvaccinated people working together? Mm-hmm. When will it be okay for people who are at work, even if they're working with unvaccinated people, to not wear their masks at work, whether you're vaccinated or unvaccinated?
Right. I mean, I think that time is coming. We're not quite there yet, and the state just reiterated today that they're again keeping their current mask mandate on, which means that everyone who's indoors in a work site keeps their mask on. Cal OSHA also has that requirement, and so that's what we all have to follow. And it kind of makes sense, right? Because you have mixed status, and it's not that much of it's not that burdensome to wear your mask. So for now, masks in indoor workplaces.
And Dr. Cody, and let me just say this to everybody. I'm going to ask my staff if you could put the Facebook link in, and for everybody who attended today, you're going to be in a drawing for goodie bags. We're going to have 3 goodie bags that we're going to give away, and you're going to like them. They're going to be full of goodies, and we're going to do that. But everybody who's on our Facebook page is also going to get an opportunity to win tickets to some concerts that the SAP Center is hosting. And I don't know all the names of those or all the details, but I do want to just encourage everybody right now to get on our Facebook page. And the reason is we're really going to be sending out to all of you some new videos that we're getting. And I want to ask our staff to show at least 2 of them, and maybe the Olympian and the young folks telling us about getting vaccinated. And these are the kinds of things we're going to want you to to send out. So you're going to want to get on that Facebook page, because we're going to be announcing some concert tickets for our volunteers and also for people getting vaccinated, which is one of the reasons we wanted to chat with you. So could I have the staff maybe do 2 of those for us?
Oh, hey, didn't see you there. What's up, fellow teenagers? The County of Santa Clara is hosting a teen vaccination event May 11th, 12th, and 13th. Head down to Levi Stadium and go get vaxxed so you can get outside and turn up with me, okay? Stay golden. Love y'all.
Hey guys, what's up? It's Gabby Douglas here. First of all, I hope everyone is taking care of themselves, staying healthy, safe, and strong during this time. I wanted to thank every single person for doing their part to protect themselves and their community. And if you want to do your part, head to the Levi Stadium and protect yourself and your community. I love you all so much. Mwah. Keep up the amazing work.
Hey, County of Santa. Hi, I'm Melina Trujillo. I'm almost 16 years old, and I can't wait to get vaccinated to hang out with my friends, go to school full time, and return back to normal. Here's my sister, Isela.
Hi, I'm Isela Trujillo. I'm 13 years old, and I can't wait to get vaccinated. This is my twin brother, Michael Damien.
I'm Michael Damien. I'm 13 years old, and I can't wait to get vaccinated. Let's get back to normal.
Infórmate.
Edúcate.
Vacúnate.
So we are going to be asking for your help, because we're also going to be using our Facebook page to announce contests. And we need your help in getting that information out so that we can make sure that we're doing our best to encourage folks. So as an example, we did a vaccine site that had that we gave out boba drinks, and we got a lot of young people to come out. We've done them where we've done burritos and mariachis, and I got to thank Magdalena Carrasco, Councilmember Carrasco, for that. But we're going to need your help, because we're going to be digging deep into our neighborhoods. And so please get on our Facebook and our Twitter. And like I said, we'll be announcing these contests and asking you to get the word out, and then you will be in our drawings as well, because we know part of what we need to do is make sure we can keep people interested, because we got to get everybody across the finish line, not just some people. We want everyone. So please make sure you sign up, and we're sending out our Instagram and our Twitter. And I know a lot of you are following the county on Twitter, and we are too. And then I wanted to get to a couple other questions if we could. And one question that folks have is, Dr. Cody, for the fall when children go back to school, what happens? Some people are concerned about risks to their children if their teachers aren't vaccinated. I don't know if you
so yeah, I mean, so one is, I want to say that I and the health officers around the Bay Area, and probably I would guess around the state, we are 1,000% committed with getting everyone back in school for in-person learning. There is absolutely no reason that we can't do that. We've got to do that. So everyone has to get back in school. I would say, hopefully most of the teachers and staff in the school site are going to be vaccinated, as well as in the middle school and high school, because those age groups can be vaccinated too, and that will make school quite safe. If a teacher is not vaccinated, they'll wear a face covering. protect the kids, you know, just like they do now in the in-person settings. Right. So the good news is we know, you know, there's a lot of other ways to prevent spread of COVID. We've been doing them for the last year. You know, the vaccine is the best because once everyone's vaccinated, we can kind of go back to normal life. But we do know how to wear masks, so that can continue.
And Dr. Cody, I know that you have been really steeped in this, but I'm wondering if you could just remind people a little bit about indoor events and meetings and events versus outdoor in terms of mask wearing and social distancing.
Right. So right now, according to the state mask guidelines, when you're outdoors, you don't need to wear a mask unless it's a crowded event or you're doing something where you're going to be, you know, like right up next to somebody. Then according to the state guidelines, you need to wear a mask. So outdoors, you know, this is quite different than what we were saying before, but we've documented so little spread outdoors that's really been relaxed. And that's been the case in the state guidance since the beginning of May. Indoors, still got to wear a mask. Not everyone's vaccinated. It's difficult to know what everyone's vaccination status is. And we know that that's the safest thing to do. It protects everybody.
Just as a reminder, the Facebook page is in the chat again. So we need you to go sign up for it, like it, and get connected to it because you're going to get a lot of information there. You also will be able to access these videos via YouTube, which Alex has put in the chat. And one of the folks that we had was from Harry Potter. That is also, we'll send that one out too. And if you didn't recognize everybody who you saw on these videos, that's not a problem because that's not for you. It's for these other folks and these younger people that we want to get out. So please share them. And I think I'm just going to look and see that is it correct that we won't be able to, so one question is, how do people who aren't able to get vaxxed, you know, maybe they have a compromised immune system, so they're not able to be vaccinated. How do we protect them and how long do they have to wear masks or do we know yet?
So two important ways to protect people who are immunocompromised or can't be vaccinated for whatever reason, that everyone around them gets vaccinated. That's really the key. So you'd certainly want to make sure that everyone in the family got vaccinated and hopefully everyone in the work site got vaccinated. And even better, you know, enough people in the community that we just like slow down the spread of this. And we're getting there. So that's the first thing. The second is to wear that the person that's not vaccinated wears a mask. So two, but we're, you know, the idea is that we get the vaccination levels high enough that we would really slow down the spread of COVID enough that even people who weren't vaccinated would be protected by all the people around them who are vaccinated.
So the goal is if you can be vaccinated, get vaccinated. That protects everybody. That's really the way to do it. And Tom Felton, who is Draco Malfoy, you can also see that we put his cameo in the link, in the chat. And, you know, one question we got from Stanford Shopping Center is why don't we vaccinate people in the shopping center at Stanford on the weekends, and everyone who gets vaccinated could get a Starbucks card or a pressed juicery, something like that. Yes, we're looking at shopping centers, and we're also working with businesses as well. What you're also going to see is Los Tigres del Norte is also, their clip is that Damian Trujillo got is also in our chat. It's a really great quick clip that's a great way for folks to get the word out. And then there's also the Evergreen Initiative in San Jose, which is really a remarkable group of high school students who are out there trying to get people vaccinated. So here's our message today. One, I want to thank Dr. Cody for all her great work. Two, I promised you all this would be 30 minutes. I'm keeping to my promise. We need you to make sure that you are taking advantage of these links, getting them out there with your social media. We're going to be announcing contests on our Facebook site, and we need you to push those out. Now, one question we got is, what happens if I already got vaccinated? And you're right, there's some of you that we're going to have to figure out a way to have everybody who's been vaccinated get into our some of these lottos, but some of them are very focused, like there are tickets for kids, you know, that are right within certain age groups, because we're really trying to get people out to get vaccinated. I want to say, Dr. Cody, thank you so much for being here. I know we're pulling you in a million directions, so I appreciate every minute you spend with us. Thank you. I want to thank all of you who've been so great in helping us. Please get on that Facebook page. We're going to need your help. We don't have that much longer to go, but now that we have 12-year-olds, we've got to get those littles, those young people vaccinated, because eventually we're going to get to the even younger folks, and we're going to need to get everybody out of line so we have room for everybody as they come up and are available. So thank you all. Be safe, be well, and have a great rest of your day. And thank you, Dr. Cody.
Thank you. Thank you, everybody. Bye.
Bye. Thanks all. Thank you, thank you, thank you. Don't forget to get on that Facebook page and get busy communicating. Send out these videos and help us. And we're going to also make sure, to my team, let's make sure we've got a list of all the places that you can just walk up and go get a vaccine, which is every place. So please join us as soon as you can. Get that information and get that out to your community. And thank you all very, very much for being community ambassadors. And we will also announce the winner of our goodie bags. And Swanee, no, I'm sorry, there are no 49er tickets or 49ers in your goodie bag. So they wouldn't let us do that. All right. Thank you all. Be well, be safe. Thanks again, Dr. Cody.
Bye.
Bye.
Thank you. Bye.
Thanks all. Thank you.